So Bob emails, what do you say?
Yeah.
Anonymous listener from Utah, she says, Dr. Kirk and Bob, I've listened to your podcast since 2019. The episodes with Bob are always my favorites.
Thank you.
I have appreciated the educational information and inspiration of Bob's journey the most as it's been so helpful in my healing experiences. I myself have been in deep long-term therapy with the same therapist for approximately 9 years. I started with somewhat of a disorganized attachment style with a lot of mistrust, resistance, and avoidant behavior. I also am the survivor of childhood sexual abuse. I didn't realize the depth of my issues when I started therapy, however, and thought I just was struggling with postpartum depression. The journey has been intense, but absolutely life-changing. We have almost completely rewritten my internal schemas, and I now experience times of what I feel are earned secure attachment. I have had to work through periods of avoidant and anxious attachment over the years. My therapist is incredible. She primarily practices non-directive psychodynamic therapy from an object relations perspective and is now in training to become an analyst.
Wow.
She has been incredibly patient with me, willing to go at my pacing. She is boundaried, caring, skilled at what she does. I know for a fact I wouldn't be alive today if it weren't for our work together.
Wow.
I'm writing you because you talk a lot about the bad clinicians or the things that can go wrong in therapy. So rarely do you get to hear about solid practitioners who are doing inspiring work every day for years. So to those folks out there, thank you. I can sense we are close to finishing our therapeutic work together, and I'm almost there, and what a journey it's been. I trust her and myself to sort out an ending that makes sense given the length and depth of our work. But do you have any advice or experience on what a healthy end might look like given the impact and intensity of our therapeutic process? Bob, what do you think?
Well, I'm so pleased for you just to start. That's really fantastic. Clearly, you've done a tremendous amount of work in your therapy, and I'm really glad for how far you've come. Good on you. A good end. Happy, sad? Kind of like your email has got the bright spots of, your learning and growth and the good things that have come as a result of it. And then, sad to say goodbye to somebody that you love. I don't know what else to call it. It's happy, sad. Just seems to me that a good end will have those elements.
Yeah, grief and setting you up for other kind of supports, which I'm sure you've talked about, making sure that you have other ways of getting the kind of love and attunement, probably, maybe a spouse, I don't know, maybe another therapist, I don't know. But yeah, grieving and talking and processing and transitioning and caring and acknowledging and preparing and all the things is good. But yeah, I reflect what Bob was saying as well, just appreciating how wonderful it is. And it would upset me if the message of this podcast is that therapists suck. So, I'm glad that you're saying this, and I hadn't thought that would be a thing. But if that is a thing, then I need to, at the very least, occasionally mention that. I try in my reaction videos and in the podcast to say, by the way, most therapists are really good, and there's a lot of really ethical, competent, caring, right-headed therapists out there. So, and I try, at least when I think to say the kinds of things that I'm talking about and the kind of things Bob and I talk about are not particular to us. We didn't invent these things. We don't have a monopoly on these things. We are one of many. So finding those people is important. They're out there, and sometimes it takes a little bit to find them, but they're absolutely out there. All right, another email. Haley Rose. So Haley Rose on YouTube, she has a YouTube channel, and she makes these out of context videos about me. She will edit my reaction videos and find these little clips of me saying ridiculous things, and then I can't imagine how much time is spent because she has to watch all the videos and then she has to, download them and then clip them and then edit them together. But yeah, in my reaction videos, I'll role play, sometimes, and I'll be saying something like, well, if you have to ask for sex, maybe there's a way to do it. Like, how about you say it this way, or you don't say it this way, and then I role play something, and then she'll take that out of context as if I'm saying it's really hilarious.
Sounds funny.
And sometimes people are worried that it's going to hurt my feelings. It doesn't hurt my feelings because it's not done maliciously.
No, it sounds like it's playful.
And it's cringy to myself because I'm thinking, what's wrong with me that I would say that?
Oh, I hear that. Yeah.
But I don't lament it at all, and it doesn't trip me up at all, honestly. But I'm getting to the point where I'll be saying something in a video, and I'll realize in the moment, oh no, that's going to make it into an out of context video, isn't it? Anyway, so she's a clinician as well. She says, can clients with borderline personality disorder experience deep corrective experiences without extreme transference in session? Can clients with borderline experience deep corrective experiences without extreme transference in a session? So just chiming in, the basis for this question is, I think, based on the way that we've talked about the requirement almost, and I think I've even worded it that way, but maybe we should question that in order for a truly borderline client to experience a corrective experience, there has to be the transference, countertransference, the indicator of an intense relationship, one that can be corrective, is marked by that transference. And I think typically why we're saying something like that is to set people's expectation, therapists' expectation, that transference is going to happen. So be not only like accepting, but be ready for it. Actually frame it in your mind as a good sign, not as like a pesky little thing on the side, as it's typically, or as some failure of the client or yourself. But what Haley Rose is asking is, does it always need to happen? And she goes on, I've worked with many clients with borderline and have seen incredible growth in their lives. However, I haven't encountered the intense transference reactions you've described, such as a client being hostile or lashing out at you in session. Even when I receive transfers from colleagues who feel frustrated or confused by a client with borderline, I often find them engaging the client and not particularly difficult. This makes you wonder, am I missing something? I know these reactions can lead to deep corrective experiences, the transference, countertransference, but I've also seen my clients heal and thrive without them. Would love to hear your insights and Bob's as well. P.S. I read that Helvetic's font is helpful for dyslexia, so let me know if it is. So, end of email. Chiming in here, I have been talking about how I am suddenly realizing in my old age that I have mild dyslexia, and there are so many different aspects that are likely a result. I just realized another one recently that always confused and plagued me when people were on the phone and you would be getting someone to spell something. Like there was a time in my early life when I would be jotting down someone's name or something, and they would say, my name is so-and-so, and I would say, oh, how do you spell that? And they would, rattle through, and it would be literally 10 times too fast for me to comprehend and actually write down. And I always thought that people were just ignorant as to how slow someone would be, but I didn't realize that they were actually doing it based on their experience on how fast other people would actually be able to retain all those letters. And I've always had to, at times I remember going, I need you to do one letter at a time, literally, because if you do 3 letters, it'll go on my head and it'll just be obliterated and it'll just be gone. So Haley Rose has been occasionally suggesting things, which is helpful. And she's saying that Helvetic's font is helpful for dyslexia. Which one is Helvetic's font?
Isn't that the standard Mac one?
Let me look. Oh, it's not in Google Docs. So let me look.
It's Helvetica though in my computer.
Helvetica fonts, images. is it's really close to aerial, actually. There's no, what do they call it? Sans, what? There's no serifs. It's very 80s kind of looking to me. It's very simple. But yeah, it's very similar. Well, so, and maybe this is another aspect, Haley, that you're alerting me to, because I've always preferred Arial font, and I always defont to that. Or in Word, the other font that I like, it seems kind of like Arial to me, but it is Calibri, which is to me very similar to Arial, which is very similar to Helvetic. So I don't know, maybe that's another thing that you just alerted me to about my mild dyslexia, is that I like a very simple 80s font, if that makes any sense. Sans serif font, yeah. Anyway, so Bob, what do you think? She's saying not only one, but a lot of her clients, if not all of her clients with borderline, have had, in her observation, not any kind of noticeable or distracting transference, and have also experienced seemingly good effects from therapy and corrective experiences, even deep relationships. What do you think about that?
Well, I'm curious if you'd consider asking your clients, how come you don't get mad at me like you did your last therapist? Because I'm presuming that Haley has that kind of information and, can ask about that sort of thing. I presume she could. What's the difference? And then the other thought I had is, it might be that you just have a naturally flexible attitude to things that perhaps another therapist would catch on, and so the wrinkle between you and your clients doesn't come up because for whatever reason. But I don't know anything about whether or not there has to, because I think what you're really saying is, does there have to be conflict for there to be progress? Like if there's deep transference, does it have to have confliction? Do we have to survive ruptures or turmoil or whatever? I think that's what you're asking. And I don't actually know.
Yeah. So what I'll say is that, Haley, it's possible, quite possible, that you are very good with people with borderline.
Yeah.
And this was my experience as well, that I, in the beginning, would be confused about receiving a referral or receiving a transfer. And I would find that it would be easy to navigate the waters and to avoid mines so that there weren't ruptures, or if there were, I would quickly address them to at least the likelihood that it wouldn't blow up in my face the way that it was for a previous therapist. So I found that if you were good and understood borderline and were effective and attuned, and your ego didn't get overblown, or you had an easier time not taking things personally, it was very easy for me, and still is very easy for me, to avoid ruptures, or again, to quickly correct for them. So it's possible, Haley, that you're just very good at that. And so when I talk about how it's normal for people who are treating borderline to experience hostility and lashing out, it's quite possible that the sort of borderline client that you've worked with is not prone to that. But I guarantee you that if you worked with a borderline client that was prone to lashing out and hostility, there is no saving you from that. There's no competence that will prevent that. It will happen, especially if the relationship is deepened. So I think you've been lucky. I'm not saying they don't have borderline. I trust you that, because I know you're a good therapist and are smart. So yes, all your clients did have borderline, but the ones that you're identifying, but they were just the sort that wasn't prone to that. However, if your competence wasn't as sharp, there would be ruptures in all likelihood, and therefore so they have the capability of being that way, but you're just really good at navigating those landmines in all likelihood. So maybe, I don't know, but I could see myself exaggerating in the past and saying that it's a necessary part of it, and if you don't have those hostilities or lashing out, then you're not actually in a deep enough relationship for it to be a corrective experience. I could see myself saying that. And I mean, it depends on what I mean by that, I suppose, but to just say that without clarifying it is an oversimplification, and Haley, I think, is pointing that out. All right, let's take a break, and we get back, more emails. What do you say, Bob?
Yep.
All right, back from the break. Middle tier anonymous patron. She says, I am a relatively new therapist in private practice. A while ago, I had an intake session with a couple, and it was very clear from the beginning that it was not going to be a good fit. Okay, relatively new therapist, private practice, couple, and middle tier anonymous patron. She's saying right away, I don't think this is a good fit. And also the couple therapy was contraindicated due to the presence of verbal and emotional abuse and some presenting problems that were more appropriate for individual therapy and way outside my scope. Okay, so observing abuse and presenting problems that were, according to her, appropriate for individual therapy and also way outside her scope. So I don't know what that is, but going on. Mm-hmm. After 2 sessions, I explained why it was not going to be a good fit, and I terminated and provided referrals. I also had some obvious countertransference issues that I knew wasn't strong enough to compartmentalize, and I wasn't strong enough to compartmentalize this countertransference, which I shared with my supervisor, but obviously I didn't share it with the client. I don't have enough information or experience to officially diagnose this, but I was feeling a lot of access to vibes from one of the partners. So just chiming in, that's a way of saying borderline, typically, when people say that, or narcissism. But she's saying, I don't have enough information, because I didn't assess long enough, and I also don't have enough experience to say this with a lot of confidence, but seemed like something was going on there. Long story short, the aforementioned partner felt shocked and confused about the termination and referral, and interpreted my ability to take their case as a major rejection. My inability to take it. I got a lot of abusive emails from them, which were challenging for me to digest, and I understood that it was coming from a place of pain and major attachment insecurity. Recently, this partner reached back out and asked to receive their clinical notes, which I provided, chiming in, good job.
Yeah.
It's so often that is received with like resistance or I'm not going to, and you're just like, what the fuck is wrong with you? So she's like, I provided that.
Yep.
Despite my sinking feeling that I was going to be berated all over again based on the person's interpretation of my clinical notes, and I was right about that. The client demanded that I meet with them to take their feedback about all of this. My supervisor is advising me to hold firm a boundary and not comply with their demand and not meet with them. I don't know if my supervisor is right in saying I don't have an ethical obligation to meet with them, but I do know that this is activating a trauma response in me, and on a personal level, I definitely don't want to meet with them. And yet, I know that I am making a mistake by wanting to approach this person with reason, but there are very loud parts of me saying I should meet with them and correct all of the horrible things that they said about me and my approach. Also, I am ruminating over this client. I find myself falling asleep and waking up thinking about this person's distorted view of me. And I only saw them 2 times. As someone with so much experience and who deals with personality disorders, how have you learned to weather these harsh criticisms and distorted views? Even when you know logically that you have done nothing wrong and that the person is coming from a place of severe pain and attachment wounding. Thank you for all your work. You have been an incredible resource for me. End of email. Bob, what do you think?
Well, don't meet with them. I agree with your supervisor. There is nothing in it to engage in that level. And it sounds to me like you might be acting out of guilt, which is sort of curious. I don't know. As I was listening to this, I was thinking, are you really mad at the client? It sounds like you might be really mad and like really just jamming that down. Because what's happening to you doesn't really have anything to do with the client. It's just you in the matrix. when you get shot in the Matrix, you die in real life, right? So this is you in your internal struggle. There's something about this that's hooking you. So it's really cool on the one hand because you get a shot at learning about yourself, something about whoever this client is and how they're hitting your psyche or whatever. I don't like saying it that way because it says that the client's doing the hitting. However this is landing for you, whatever your response is really good for you to keep exploring and learn about, because you're going to meet someone like this again, probably, and perhaps you'd like to do a better job of either screening or working effectively with somebody who's got this kind of presentation. I go for the second one because you're a therapist and this is what you signed on for. So learn how to do it. There's nothing bad in any of this, but I think engaging with the client further is just going to inflame something and isn't going to help them. And I don't think it's going to help you. And it just sounds like you're guilty and maybe you're pissed off.
Right. And it sounds like you recognize this, anonymous patron, and your supervisor as well,
yeah.
that meeting with them with the goal of at least even somewhat getting them to calm down or to understand or to feel compassion from you is extremely unlikely to happen. For people with these kinds of traumas and these kind of schemas and these distortions and perceptual semi-delusions, which is why it's called borderline delusional, there's no logical way out of a semi-delusion. And as Bob was saying, it just re-engages and re-inflames. So unless you're willing to really commit to the long term, there's nothing there. It might not harm anything, you or the client, but it could. But at the very least, it's extremely unlikely to be productive for you or for the client. But so I want to go kind of point by point. So before I get to the actual question, I just want to, as a asterisk, get to some of the other. So at the very beginning, and you lay it out well, you cover your bases, but I just want to comment on a couple things up front. And this is what a lot of people will say, is that couple therapy is contraindicated. That phrase annoys me because it's as if it's scientifically, objectively wrong to do couple therapy in that situation. You can say that couple therapy, given all the factors, I recommend that you do this over this. But to say that couple therapy with all couple therapists is contraindicated, you know what I mean? It's sort of like if someone broke their leg and you would say, well, it's not appropriate treatment to have them meditate or something to fix their bone, right? There's a particular treatment for that. This is that kind of language where it's very objective and very sure and very black and white. Because I have treated clients like this. I specialize in this. And I've done couple therapy at times with these. So if it's almost always that couple or family therapy is contraindicated. It's almost never in the reverse. Almost never do people say individual therapy is contraindicated, because our society is so individual oriented, and our culture within therapy is so afraid to get chaos and get relational with people.
That's true.
So
it's just a fear-based way of bowing out.
Yeah, it's easier. It's avoiding.
Yeah.
Now, can absolutely you, anonymous patron, say to yourself, given the big picture, that you don't think it's good in general for couple therapy to be the first thing that this couple engages in, and you yourself don't want to provide that couple therapy? Yeah. But if you went to me, if I was your supervisor, I wouldn't say couple therapy was contraindicated. I would say, let's talk about what you want to do with this. And if you decide that you want to recommend strongly that they don't engage in couple therapy and instead engage in individual therapy, I would support that. But that doesn't mean that couple therapy in general with all couple therapists is contraindicated. And people say that's like, well, you can't have an abusive relationship in couple therapy. And it's like, well, you could. It does, if you do it in the cartoonish way where you're validating everyone, then yeah, that's contraindicated, I guess. But if you actually are going after someone for being abusive in front of the victim, and you have contact with the victim and you create a safe place to be able to get information from the victim, I can't think of a better form of therapy, honestly, because if I'm treating just the victim and my colleague across town is treating just the perpetrator, there's a con to that. There's a pro to that, but it's just this aversion and phobia of getting messy, So, and I've done that work. I've done couple therapy with abusive couples. Are there times when I will say, yeah, this isn't working because the victim doesn't feel safe enough with but in a situation like that, honestly, we're talking about shelter. If the victim isn't comfortable talking with me after doing a lot of work to develop the relationship, then we have a person that is underneath someone's thumb completely. And individual therapy is contraindicated. I need to start recommending to the victim that they get out, and that they start talking with a victim's advocate and a DV advocate, and they get to a shelter. And I've done that work too. Anyway, so there's that pit. And then you say that the presenting problems were more appropriate for individual therapy. Again, you can say that for you and given the big picture. And I'm saying it a bit confusing. What I'm saying is that you can absolutely say, given the resources available to me and the resources in my referral network, like you might not know a couple therapists that specializes in abusive relationships, or the abuse is so bad and so rigid that you imagine that if you were to route them to one or the other, 90% of the time, individual therapy is more likely to work. That's a different statement than individual therapy is indicated and couple therapy is contraindicated. You know what I'm saying? Anyway. And then you also say it's way outside your scope, which is good for you to admit. I trust your opinion on that. And as Bob said, there's various different ways to do a screening. I would recommend just getting that within your scope and, knowing your limits, of course, but these kind of things happen. And if we don't do it, sometimes there isn't really anyone to do it. But of course, understanding your scope and your limits and being okay with that and not taking on every single client is, of course, ethical and moral and, a way to avoid burnout and lawsuits and all sorts of things. But anyway, and then you say, after 2 sessions, I explained why it was not going to be a good fit and I provided referrals. So I don't know what happened in that session. And if someone was significantly distorted and perceptually problematic, there's really no way around them misinterpreting that and flipping out. But it kind of sounds like that's the case. But there's also a possibility that the termination wasn't handled in an ideal, optimal way. I'll tell you that when I've run into this and I've had to refer someone, what I try to do, if I predict that this will be the biggest landmine I could possibly step on, which is to reject them and kick them out of my office, which is essentially what I'm doing, then for self-preservation reasons, but also to help the client to just be able to trust therapists, I try to not let it be that, but let it be their choice. And there are ways to actually lead them down that road. It's not always possible, and I might not have the time or the energy. And you could argue it's unethical because it's manipulative or something. Maybe I wouldn't charge them, but I've done this before where I've predicted that if I terminate with them, which is the ultimate goal here, that everyone's life, including them, but mine in particular, is going to be like miserable. So how do I lead them? And there are techniques to lead a client down a road so that they actually say, maybe it's best if we see this other therapist. Like one way to do it is you say, so I would like to involve another therapist in this for, what various reasons that you convince them. And so I'd like to meet you with them, and then we'll do both this sort of thing, or I want you to see an individual therapist, the two of you, and let's get that moving real quick. And then we'll meet, and then, we'll continue doing work, and you sort of grin and bear it for a couple of weeks. And then eventually, you really you talk with the other therapist, and you really try to get that relationship going, and then you talk in session and you hear from the client, they're like, yeah, I'm really bonding with my individual therapist. And then you say something like, it might be actually for scheduling and money and also for yours, and also for just simplicity that we table couple therapy for now and just focus on individual therapy because there's a lot to tackle there. And then once couple therapy, there's enough room in the situation for that, then let's revisit that, and then you have a client say, oh, okay. So that's different, right? Now that could still backfire. It's also hard to manage, and it might take literally 8 months to set up individual therapy with someone. So I'm not saying it's easy, but I've done stuff like that with people. And, but having said that, I'm guessing that there wasn't any way to avoid, given what I'm hearing in terms of the response from them. Is it normal for a client to feel rejection? Yeah. But the way that this is playing out afterwards, with them berating you and demanding and, I need you to meet with you, so you got to take my feedback. Like, this looks like someone that has a particular kind of trauma reactivity and a particular pattern. And so there's, in all likelihood, no amount of diplomacy or manipulation or niceness could have stopped that. Okay. So then you also say, that the client demanded to meet with you for take feedback. I agree with Bob. There's nothing that can come out of that. And then you say, your supervisor is saying, hold the boundary, don't do it. And then you say, I don't know if my supervisor is right in saying I don't have an ethical obligation to meet with them. So to evaluate one's ethical obligation, we have an ethical obligation to have beneficence over maleficence. We have to benefit versus harm. And when we look at this situation, do we believe that by meeting with the client that it's worth the risk or that there would be a benefit to it? Well, we've concluded, your supervisor also, that there's a good possibility this would just make the matter worse. It certainly wouldn't be predicted it would just suddenly fix the problem. And so it's not worth it for the client's sake. But even outside of that, we have the issue of your own sanity and your own job satisfaction and your own humanity, your own rights. And even if it would benefit the client, you're already suffering from what's happening, and exposing yourself essentially to abuse from the client is just not okay. I don't care if it benefits the client, honestly. And you're talking about ruminating over the client. So I used to be this way, and I am not so much anymore. If I worked with a client currently that did something like this to me, and I was involved with them either in this capacity or in an ongoing capacity, I would also be somewhat ruminating for it. There's a number of different reasons for this. One is just humanity, and also, to be a therapist, we signed up to help, and we have a client that is telling us, and it's not just telling us, but it's the emotion. It gets under your skin. The way that these people can get under your skin is incredible. Their energy, the words they use, the kinds of things they poke at. It is almost impossible. I would say it's impossible to protect no one has thick enough skin against these sorts of people. They essentially learn from the best regarding how to get underneath people's skin because they were abused growing up, and their defense is to get under people's skin. So since they were 4 years old, they've learned how to get underneath people's skin. Subconsciously, they've learned this. So it's impossible to not let it get under skin. However, as a therapist, we're particularly worried about this, as I've been saying. But also, if you're kind of like me and you have some obsessive compulsive personality traits of perfectionism and shame trauma, as I was talking about in my deep dive on obsessive compulsive personality disorder, then this is going to ruminate because there's a person out there that hates you. And it's an imperfection that at least one person believes, and maybe will be convinced by other people they talk to, that you're a horrible person, and that, and you believe that, and there's a part of you that's like, well, if I could just convince them, then this could go away, and that's normal. And so that's what causes that loop. And I've been there, and I'm still there on the other topics currently. There's always that loop of just like, if I can explain, if they can listen to me, then I can clean this mess on my personality, even though there's not a practical reason for it. You know what I mean? But it's hard. So I get that, and there's no amount of like just let it go that's gonna let it go. So you ask, how have I learned to weather these harsh criticisms? I'll say I haven't. I hope I don't paint a picture that somehow working with borderline clients that it's like a breeze. It's not. It's fucking hard, man. For borderline clients that are hostile, Haley hasn't come across one, but for the ones that are, it's being victimized. I am being victimized by hostile, at least in the moment, they're not exhibiting any empathy. And they're very good, and they're identifying with the abuser, and they're coming after me. I'm not. I don't enjoy it.
Universe, would that ever be easy?
Yeah. So weathering. Now, I am Bennett. You're a relatively new therapist. One thing that does help me weather it is that I've been through it so many times, and it's resolved, a good percentage of the time, that there's a sizable percentage of me that is strongly assuming or is establishing to myself that this isn't a personal thing, and that they will eventually, maybe years from now, stop doing this, and then maybe a few years after that, thank me for putting up with the shit. Or maybe they'll even thank me next week. I don't know. But there's that. Also, I heavily focus on the inner child that is communicating with me. When a 4-year-old lashes out at me, I don't take it personally. And when a 4-year-old version of a client lashes out to me, I also don't take it as personally. There's that. Also, I reassure myself that whatever kind of ruckus that they create online about me, I'll figure it out. Because that's one of the things about OCPD that I would get real worked up about is, what if they start campaigning against me? Then that just is a shame infection that goes through society, and I can't do anything about it. And I have learned over time that whatever happens, it's not going to be a disaster, or I'll be able to manage it somehow. So those are all the things that I say. And part of that has to do with experience that you just don't have, and you just have to go through it. Now, it sounds like you don't want to work with clients like this. You say it's outside your scope, so maybe you do refer out, but it's hard to screen this. And often you don't find out until 6 months in, and then where are you at? And terminating with a client at that point without having sufficiently screened them in the beginning is unethical as a therapist, in my opinion. And what a glorious thing it is to be able to help people like this. And if we don't help them, who will? Now, if you have a colleague that is very close, that always has an availability, then maybe, but that's not typically the case. And for us therapists to refer people out, and we claim that we don't have the scope for it yet anyway, is quite likely dooming the client to never getting therapy. I know that's harsh, and I know a lot of people disagree with me on that, but it is what I believe. And who said being a therapist was all fun and games? And if we, at every turn, said, ooh, this is a big issue, this is a big deal that I don't know enough about yet, and it's hard, if all of us, or 95% of us, just said, I'm going to refer out, then what are we doing as a profession, So
who are we referring out to?
Yeah. And as I said, if you have a colleague or a group of colleagues that specialize in this and always have availability, then you could viably say, I'm going to always refer out because I know they're at the ready. But we understand that is not the case. No. If you provide referrals, there's a good chance that and if everyone did this, then, anyway.
Hey, just for what it's worth, I've been doing this for 35 years, and I still get anxious. I still get upset. I still am affected. I don't have all the answers. That's just part of the thing. So,
yeah.
With time, you develop a capacity to survive that or just live with it or deal with it or whatever. But being a therapist isn't fun.
Yeah.
A lot of the time. So,
yeah. And maybe the sort of summary or the overarching title is that I will suffer in the moment and I'll have residual distress after the session, but I quickly recover.
Yeah.
Because there's just a felt trust that everything will work out, even though I can't in the moment see a way through it. But I've just experienced it in my body so many times that I just, it doesn't stick with me because I'm like, well, I don't even have to say the sentence to myself. I just very quickly have this intrusive thought that is saying, there's no use in thinking about it, and things usually work itself out. Just keep your eye on the ball, and everything will be okay. Yeah, one way or the other, you know.
Right. Probably a thing you could only develop through experience.
Right.
Nobody can tell you that and have that stick. You have to chew the dirt.
Right.
So keep chewing.
All right, let's take a break. One more email. What do you say?
Right.
All right, one more email. Anonymous YouTube member. She says, I started with a new therapist this year, and I've sometimes struggled with some transference-related concerns with him, which I've discussed with him in session. I'm a songwriter in my free time. It's mostly just for me, though occasionally I'll share some songs with a few friends or family. Just chiming in. That's exactly how I would describe myself. Going on. And I've written and recorded a couple songs about things we've talked about in session and about the transference issues. It's nothing too weird, just things like being very worried that he'll think badly of me if I disclose mistakes I've made in my life, being concerned that he might lose patience with me talking about my anxieties, or being anxious about the prospect of eventually having to transition to another therapist. I asked my therapist if I could share these couple of songs with him, and he agreed. He messaged afterwards to thank me for sharing them, but we didn't discuss them much in session because I'm embarrassed to bring them up. And I've now gotten really anxious after the fact that maybe it was too much, or that talking about transference stuff in song form was weird for him. What are your views on a patient sharing their own music or other creative art stuff with therapists, particularly if it's sort of about the therapist-client relationship? Is it super weird or awkward? Thank you so much. Even if you don't get a chance to respond to this, I appreciate all the content you make. End of email. Bob, what do you think?
Oh, there's something kind of endearing about all this. And just as I'm listening to it, I'm thinking, you're in your transference as you talk about this, your terror about, maybe you're too much, maybe it's a burden, maybe it's this, that, or maybe he's going to have some adverse reaction to the thing, is exactly why you should bring it up and talk about it. And on the one hand, I feel sad because clearly you're in pain. On the other hand, there's something that's very sweet and endearing about your fear of bringing. It's sort of like the kids' equivalent of bringing your finger painting up to mom and dad and wanting them to hang it on the fridge and celebrate it, right? Like, it just sounds like you took a risk and then you got scared and you realize there's more to the risk to take. And I'd say, get on with it. Do it.
Yeah.
Yeah.
Yeah. That's what I would say. The only thing I would add, as a songwriter who has occasionally imposed my music on other people, is that, including Bob, is that I have learned over time, and also just from my own experience having people share music with me even, or other kind of art, is that the vast majority of non-songwriter musicians or non-art types, when we give them one of our songs, they listen to it and they think, oh, that's pretty good. And that's all that they think. To us songwriters, it's like so much a representation of our soul, and it's also really hard to do. There's all these little things about songwriting and recording and performing, all these little decisions that you make and refinements that you make, and it's really hard. But for non-artsy people, or for maybe particularly non-songwriters, they just think, oh yeah, quirky little song, it doesn't, Weird Al writes music as well, and, doesn't what's his face? Adam Sandler. Yeah, doesn't Adam Sandler write funny songs about Hanukkah or something? It's just this cute little thing that people do. Oh, that's cute. But to us, it's hard and it's a big deal. And we don't need people to be like, oh my God, you're so talented. But the meaning, and especially again, when you're writing a song and the lyrics because it's not just about the lyrics, it's like the way the song sounds and feels and is emoted as you're performing it and writing it, where it came from, the deep part of your soul. Most people don't get that. The amount of times that I have, because I've been writing and imposing my music since I was 16, and I would get mostly reactions from people that was, at minimum, was just like, oh, that's nice. There would be people that wouldn't say anything. They would, I would play on a cassette tape in the car, be like, oh, I recorded this song last night. And I would play it, it'd be like 2.5 minutes. And then the music would stop and they would just talk about something else. Oh my God, yesterday, and so I learned over time that most people just do not give a shit. And, that's the way that humans are, I guess. Yeah. And for me, like when people share any kind of art with me, because I've learned, I try to, even if I don't feel it in my bones, I try to access it in my bones or at the very least try to like assess like this is probably a big deal for them. So for a therapist to not get it is understandable. And probably that's all it has to do with. I'm guessing that's what's happening with him. And if you were to tell him about what it means to you, then he probably would be very interested in that. So that's what I would say about that. But also just, you're also having what we call a vulnerability hangover. You were vulnerable and you're regretting it the next day, which is normal. But, flip the script and say, what a wonderful thing that I did, that I put myself out there. Someone else might not have received it the way that I was fantasizing, but I am real, I'm authentic, I'm creating shit and I'm sharing it. And I didn't bother him. He listened for 6 minutes to something. And that's, if he was annoyed those 6 minutes, big fucking deal. I'm not hiding. I'm in the world and I'm authentic and I'm me. And if people don't like it, then they could fuck off. And, it's another perspective. So yeah, I would just say it's probably that. And if someone shared that with me, I would have a very different reaction. How do you think you would react, Bob, if someone shared something like this with you as a non-songwriter?
Yeah, I wouldn't get the sweat behind the craft. I wouldn't know. So my reaction would probably be disproportionate from the songwriter's point of view to what's been offered, simply because I don't know what that is. I don't really know what it's like. But I might say, what does it mean to you to share? That's kind of a therapist question. And it's kind of a little dissatisfying probably because, what we really want is to be like the little kid in us who says, here's my new finger painting. And mommy and daddy put it up on the fridge and they say, oh, that's a great painting.
Yeah, certainly that's one fantasy. Another is that the therapist would know or ask questions regarding what it means to us to give it, right?
Yeah.
That it doesn't need to be loved or appreciated or highlighted, but the effort or what it means to me to create and what it meant for me to share it with you, that you would hope would be appreciated.
Well, that'd be just, grist for the mill. That's like why people go to therapy, right? Is to talk about that side of the thing or that part of the thing. I could imagine that being a really interesting and rewarding exploration. What in me gave this song?
Yeah.
Right? Why not?
Another thing that I'll mention, this is sort of a side, is that we don't have protocols in our culture about how to respond, particularly if you're not a musician.
Yeah.
Even if you wanted to be a good listener or a good therapist or a good friend, most people don't know what to say. A lot of people, because again, I've been imposing my music and I've heard a lot of different things over the years that have been kind of funny. Like there's a pattern that, and I fall into this too, which I try to resist, which is to say, oh, that sounds like The Cure or something. And that is interesting, but it's like, that's all you have to say is it sounds, and for listeners, sometimes they actually think that they're complimenting, and maybe they are, and maybe it could be received that way.
Yeah.
But if that's all you say, then okay, anything else?
I'm a Robert Smith photocopier. Is that what I am?
Right. Yeah. Thanks for telling me that I'm a facsimile of another artist that you've heard. That's great. But people just don't know what to say, and as a musician myself, songwriter myself, I know what to say because I know what I would want to hear, and I also know where it comes from. So I have a basis for like, oh, how did you record that? Like I actually ran into New Shoes, the band that is from the Northwest that recorded Up Too Late, or what's the song? Dun 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 dun. You might not remember it, but I can't wait. Dun 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 dun. And yeah, it's Portland, Seattle, but I met them, and they're a little older than us, or maybe your age because you're a little older than me. I mean, a few years.
Let's not rush it.
And I liked that song. I didn't think it was my top song of all time, but it's a good jam, and I respect it, and it holds up. And I really like the very simple drum part that they have, and there's also this percussion part, and I knew to ask about that. I said, so is that a Lynn drum machine? Because it sounds like a Lynn drum machine. And the guy's like, yeah, how did you know that? It's like, well, and it also sounded like both the snare and the clap is a little lower. It sounds like it's not just the snare. There's a little bit of clap in there. And he's like, yeah, how did you know? So, and then I'm like, and how did you record that percussion part?
Oh, yeah. You're talking chop.
Is that like a sample or something?
Yeah.
And he's like, no, that was actually my wife, the singer, because she's standing right there. And she just played live through the whole track on bottles. And I'm like, oh my God, the whole track? That's not a sample, because it sounds really great. It really is, because that song has a really great groove. And so, and so I knew to ask that, and then I also knew to sound like that's an amazing choice that you did with that. I like that.
Yeah, you're nerding out.
Right.
Good.
Well, I saw a friend of mine in an opera at the Macaw recently, and I don't know anything about opera, and I said that, but I also just was appreciating the art and the style of the opera because it was particular in terms of the stage presentation. And I could have, if I was just sort of acting normally, I would have been like, huh, that was interesting. But I tried to, get at, afterwards I'm talking with her and I'm just like, okay, get back into the mood. What did it feel like to me? How was the art working on me and my body and my mind, and what images, and sort of how do I put it into words? And that's hard to do. But yet I did it as a way of, was it like a compulsion for me to share that with her? No, but I knew that it would matter to her because she got me tickets to the opera, and she's in the opera. And no, she's another podcaster, Shandy podcast, dear Shandy, Charlene Joint. She was on The Bachelorette, and she knows that I do reality TV stuff, and so we've become friends. And anyway, and she is amazing, and in opera, I don't know how to word it, but so I got into that space of like, how was this working on me? And even if I didn't like it, if I'll do that with people, it's like, this kind of worked on me, and I don't know if this is working for you. Like that, I'm paying attention, and I'm into it, and I'm involving myself, and it's affecting me, and I have opinions. And what do you think as the artist? And how did you do that thing? And why did you do that thing? And where did you get that? Like, most people don't have that repertoire. They don't even know where to begin.
It's like a music journalist doing an interview of a music maker.
Because we don't show these conversations. If we did, then I think lay people, so to speak, would at least know what options are available to ask or to say. Like when I hear that song, I don't, like when people say, oh, that sounds like The Cure, then that's probably them in a very rudimentary way kind of saying what I'm saying, which is if they were to have more language and more self-awareness, they would say to themselves before saying it sounds like The Cure, they would say, wow, that's kind of working on me in a similar way that The Cure works on me. And how does The Cure work on me exactly? It sort of it gives me this thing, and it reminds me of this, and it sort of evokes this sort of image or this experience. It kind of, and they would know to say that, not this sounds like The Cure.
Yeah, right.
Anyway. So anonymous YouTube member, I get you.
Right on.
And if you want to send me your song, I will pay attention. Because I'm interested, and also I know what it's like to share your shit. And to have, I'll close with my favorite one that I remember. This was from like 20 years ago. I shared my new CD with someone. It was actually a family member. And the only thing he said was, and he's a good person and I like him. And in some ways, this response was at least something that he said, because there would be a lot of people be like, what? Oh, yeah, huh? Which is fine. Like it's annoying to have to listen to something you don't want to listen to. But this one relative of mine, he says, don't you have any happy songs? Well, that does it for that episode of Psychology in Seattle. Everyone out there, please take care of yourself because
you deserve it.